Hi, I'm Heidi Toby, Vice President of Social Work Programs at Therapist Development Center. If you're a first-time viewer and looking to pass your social work or MFT licensing exam, or are just interested in topics relevant to clinical social work and psychotherapy, you've come to the right place. If you like it, be sure to subscribe for updates. You can also sign up for our complete LMSW, LCSW, and MFT exam prep programs by going to our website at therapistdevelopmentcenter.com or click on our logo. On our website, you'll also find a library of ACE-approved continuing education courses to support your license renewal. ASWB Exam Prep, Clinical Assessment. Today's ASWB social work blog topic is one that's important for both the exams and our clinical practice, clinical assessment. In fact, this topic is so important that TDC created a 6-hour clinical assessment course on life stressors and coping. While this course goes into much more depth than will be needed for the LMSW or LCSW exams, it is a great resource for anyone in clinical practice. The assessment process is key to understanding why a client is seeking treatment, what their presenting issues are, and what they're hoping to gain from treatment. It also helps us identify if there are any crisis issues that need to be attended to first. A clinical assessment can utilize a variety of methods and tools and helps us gather information about both the client's history and current functioning across multiple areas. Information gathered will help us make a diagnosis if needed and develop an effective treatment plan. It's best practice to complete a thorough initial assessment with the client during the beginning stages of treatment. But assessment should also be an ongoing process throughout therapy. Clients' lives are dynamic, and their needs and priorities can shift over time. As always, our ASWB, LMSW, and LCSW programs give you everything you need to be successful on the exam, including when it comes to clinical assessment. Our hope is also that we give you knowledge and tools to carry with you into your clinical practice. ASWB Clinical Assessment Practice Question. A social worker meets with a 32-year-old woman whose wife encouraged her to seek treatment. The client shares that she was recently laid off from work due to budget cuts and feels uncertain about her ability to find employment again anytime soon. She expresses concern about being a financial burden to her wife, who she's always shared expenses with. The client shares she is struggling to find purpose in her day-to-day activities while out of work and is starting to feel hopeless about the future. What areas should the social worker assess first? A, risk of harm to self and job history. B, risk of harm to self and medical concerns. C, job history and social supports. Or D, job history and coping mechanisms. The correct answer is A, to assess for risk of harm to self and job history. Because the client expresses hopelessness, we need to explore any risk of harm to self. The client was laid off and expresses concern about her job prospects, so we also want to explore her job history to gather information that may be leading to her feeling this way. B is incorrect because no medical concerns or symptoms are discussed in the question stem. C and D are incorrect because while important, they do not address potential risk of harm to self, which must take priority when present. Thanks so much for listening. Remember, if you're studying for your exam and looking for the best LMSW, LCSW, or MFT exam prep program, please visit our website at therapistdevelopmentcenter.com to sign up. With a 95% pass rate, we offer the best study system on the market to help you pass your exam with confidence. Here at TDC, we're with you until you pass.